我嘅名叫成我打英文嘅地招。I'm Chinese-Cambodian. My family basically came here in the 80s and we came over as refugees as part of the Cambodian War that happened. So we basically made our way to Thailand and eventually to Australia. So I grew up here. I came here when I was very, very young and we grew up in the kind of outer suburbs of Melbourne. So back then, there weren't a lot of, I guess, Chinese people or Asian people. There were a few in the school that I went to, but in my primary school, there was probably 4 or 5. There was myself and my siblings, and there were some others, and I was actually related to one. Like, one of them was my cousins, actually. I probably didn't have a lot of role models when I was growing up. I have to be honest, we probably faced a little bit of racism as we grew up. I guess it was the time of when Pauline Hanson was becoming particularly prominent. So there was a time when we didn't feel like, I guess, we belonged in this country, and it for us, made us, I guess, try and fit in. It made us really feel like our kind of place in this particular country was based on our ability to do that, yeah. When I was growing up, there wasn't probably a lot of representation in terms of being queer and Asian, and so obviously for me, there felt like there was a bit of stigma in relation to the Asian community in terms of being gay or being part of the queer community. And so what I saw was that the people who were more accepting were necessarily white or necessarily Western. So I guess to some extent, I felt like I had to walk away from my Asianness to be able to join a community that embraced my queerness or my gayness. So I guess when talking about mental health with my mum, it's quite difficult because I think my Teochew, which is the dialect that I speak to her in, is actually not very good. And so I'm actually not very able to have a kind of nuanced discussion with her about these things, which, you know, makes me very sad because it's not even just, you know, talking about my mental health. I think it's also talking about my life as a queer man or as a gay man. I don't think, you know, I have the vocabulary or the way of explaining that that I can share those type of experiences with her. It's obviously not part of her lived experience. But what I found is, what I've done very recently is try to bring, I guess, those a bit more two disparate worlds together. My queer friends, gay world, whatever you want to call it, and my family, and being able to, I guess, bring those together just allows them to, I guess, allows my mum and my family to understand this other world that I'm part of in a bit more of a lived experience kind of way, where they can meet people and understand, and that, you know, there are, you know, people who live this way, and I guess remove maybe some of the stigma and also some of the fear of not knowing, yeah. For me, I have to be honest, I think obviously growing up with not a lot of representation in terms of seeing gay or queer Asians, I definitely thought that, you know, the model of desirability was definitely a certain way, and they tended to be white, it tended to be muscular, it tended to be, you know, not what I was necessarily, being Asian, being queer. I definitely think that, you know, there is a racism that maybe is perpetuated to some extent you know, the apps if you're on there, or even in the media. And so I did think there was, you know, some internalized racism that I had to process. I didn't necessarily feel like I was necessarily the pinnacle of being attractive, and I think it's taken me a while to really negotiate that space, yeah. So I feel really great about who I am. I think I've come to a place where I not only accept but really celebrate who I am. I think obviously trying to negotiate that space between being Asian and being gay, I think I've come to realise all the amazing things that have come to that, and I think appreciate where I fit in within the community as well, yeah. Yeah, so my personal journey has involved being maybe not, my mental health being not so good at one stage. And it's something that I've definitely had to go see a actual healthcare provider to actually speak about. Growing up, I've always thought, mental health and thinking about my mind has been something that I've had to deal with me on my own. But I've realised that, there are definitely things that you can, I guess, find other people to help you with, and they might give you a lot of insight to help with those things. I think there are definitely things that trigger me not understanding that I'm not doing so well with my mental health. Certain things in relation to, I guess, motivation, I think is something that I definitely look out for. But I try to overcome a lot of these through things like making sure I see people. I think sport is a big part of what I do. I'm part of an LGBTIQ badminton club, and being able to go there and play sport and also play in an environment that doesn't involve alcohol. I think a lot of the time when queer people come together or gay people come together, there tends to be a lot of drinking, or there tends to be a lot of alcohol involved, and this can obviously lead to excessive drinking. I think for me, it's great to be part of a community and in an environment where you're not just linked through that shared, I guess, fine community where it wasn't just about hooking up or trying to sleep with other people. It was just really, for me, a great opportunity to go and meet a whole lot of new people that I didn't know. Also people that I could gradually get to know over time as well. So it was such a structured environment that I could go there every week, and eventually I could get to know people. It's also a really multicultural club, and so there's lots of people from, I guess, lots of places in the world, particularly Asia. Badminton is very popular in Asia, and it's really allowed me to reconnect with, I guess, my queerness and combine that with my Asianness as well, and be able to see lots of examples of how to be Asian and how to be queer or gay or whatever the spectrum might be. Yeah. If someone was experiencing negative mental health within, I guess, the Chinese-Cambodian community, and if they were queer, what I'd suggest is, I think it's really important to find community. I think it's really important to find people who actually, I guess, understand you, and that could be people who have, a shared lived experience, I guess what a lot of people call their chosen family. I know that obviously you've got your blood family, but then they don't necessarily understand, I guess, the experiences that you've had, specifically those related to being someone queer. I definitely suggest you talk to someone. I think it's really important to be able to have people in your life that you trust and that you can actually share things with. And then ultimately, I think it's really important to have a great relationship with your GP or your healthcare provider, so that you can have those honest discussions where there's no stigma around any of those things, and you can get the help that you need if it comes to that.我嘅名嘅姓，唔知解我嘅故事。